Good afternoon. I'm David Baiada, the CEO here at Baiada Home Healthcare, and today is Friday, June 5th, and this is your coronavirus CEO update. A lot's happening out in society, particularly as we focus on reopening. Every community is handling it a little different, and even for me, as I look out my window or the days when I come into the office and I drive, I'm watching the amount of traffic increase every day. And to me, that's a sign of hope and optimism, but it's also a sign that we need to be very thoughtful and very intentional and very careful, because our responsibility to each other and to our clients is of great paramount, and I think we have to be careful not to let our guard down. And so Nora is here today to talk a little bit about screening and how we monitor and observe and stay in touch with symptoms to ensure that we don't inadvertently create risk for ourselves, our family, our coworkers, and our clients. Nora?
Thank you, David. And again, it's a pleasure to be with you and to, again, recognize the tremendous work that each of you are doing day in and day out with our clients. And David's right. We need to sometimes refresh things we've been doing for a long period of time. And it's actually about 3 months now we've been worrying about screening. And so I wanted to talk a little bit about the importance of screening yourself and screening the clients that you're serving. First and foremost, as we think about you and your day-to-day work, it's so important. You live the Baiada way. You wake up every morning. You want to fill that shift. You want to make sure that that client doesn't go uncovered. And so you do your little self-check and you feel like you're okay and you're going to power through the day. I would ask you to think today and in the subsequent months to think a little more deeply about how you're feeling before you go to work. This virus is terribly contagious, and what we know about it is that everybody develops symptoms differently. And so it's really important that you assess your feelings that day. And even the slightest little cough as I'm clearing my throat should cause you to think, am I at the top of my game? So you want to check yourself. You know, early on we talked about cough, fever, and shortness of breath as being the three main symptoms. But now we know that there's other things. There's headaches and muscle aches and this loss of taste and smell and a sore throat. And not all of them are the same, and not all of them present themselves as the sorest throat you ever felt. They sort of start with tickles and scratches. And so I'd ask you to think about, as you prepare yourself, you're getting ready for work, and you think about, do I have a fever today? Have I felt feverish over the night? Do I have any of these symptoms? So that, again, you alert your team in the office if you're just not feeling right. Because oftentimes what we're learning is that's the first indication that you may have been exposed to COVID and are actually becoming symptomatic. Similarly, we'd like you to really think about the importance of screening your clients. You know these clients better than anybody else. You've worked with them for years in a lot of cases. And so you know when they're just not having a good day, that maybe they're not quite themselves. But go through that checklist in your mind and make sure that you're paying attention to any subtle changes that that client is presenting with, to whether that's a low-grade fever, some little cough, sometimes a taste and a change in the taste, so that in fact you can alert the team in the office and we can report those symptoms to the primary care physician and get good direction. So again, today's coming to you in a reminder topic of something that you probably do day in and day out and have done now for 3 months and not thought much about it. And so my call to you today is to ask you to think more deeply about it, to look for those early warning symptoms and do what it is you do best, which is advocate and keep our clients and yourselves as safe as possible.
That's great. Thanks, Nora. And as I try and do each week, I thought it would be great to send you into the weekend with some recognition of some really thoughtful screening and reflection by one of our home health aides out in the community. And this story is a great way to end the week. I'm going to go ahead and read it off the slide. It says, "Your extraordinary home health aide, Juanita Vargas, cares for my 94-year-old mother who suffers from dementia and is bedridden. Our biggest fear was that one of our frail parents would contract COVID-19 and both of their lives would be at risk. We were advised that Juanita may have been exposed to COVID-19 but had no symptoms. She immediately alerted the proper work authorities and took herself off the schedule to care for Mom. Her initial response to testing was negative, but shortly thereafter, she tested positive on her second test. I can't tell you how appreciative we are at the due diligence of Juanita. She could have gone to work, but thought twice and considered the well-being of those in her care over her own financial situation. I'm truly grateful to Juanita and Client Services Manager Sarah Gerner, who is assuring that Mom gets the right care while Juanita is out. Sarah knows that Dad is quite particular and who's responsible for Mom's care. Sarah's patience is remarkable. I thank you and your team for all of your efforts, as we know these are challenging times. Juanita is Mom's guardian angel, who continues to be a blessing to our family and watches over Mom as if she were a member of her own family." Thanks to Juanita, thanks to Sarah, and thanks to each and every one of you for being thoughtful and deliberate about your own symptoms and of those of your clients to ensure we keep each other and our clients safe and healthy. Have a great weekend. We'll see you next week.